Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Today's episode is preparing for a doctor's appointment. Managing lupus requires regular checkups with your healthcare team, even when in remission. And since lupus can attack multiple organs in the body, keeping up with healthcare providers might mean managing several different specialist appointments. It can seem daunting, but with a few helpful tips, you can be prepared for your doctor's appointment. Today, we are thrilled to have Ashley Holden, a certified health education specialist here at the Lupus Foundation of America. She will walk you through important tips to make sure you have successful doctor's appointments. Thank you, Ashley, for being here today.
Thank you. Every appointment you have is an opportunity to explain and discuss your problems or concerns with your healthcare provider. Your healthcare provider, whether they are a doctor, nurse practitioner, or physician's assistant, should listen to your concerns and work with you to determine a plan of action. Unfortunately, there usually is not a lot of time allotted per visit. Being prepared for the appointment will help you get the most out of your time with the healthcare provider and make sure your expectations and questions are addressed. Any doctor, such as a family practitioner, internist, or pediatrician, can diagnose lupus. However, most people with lupus will see a rheumatologist. They specialize in diseases of the joints and muscles. Keep in mind that the type of lupus you have and your symptoms will determine what type of doctor you may see for treatment. If lupus has caused damage to a particular organ, other specialists may need to be consulted. These specialists can include a dermatologist, nephrologist, cardiologist, neurologist, gastroenterologist, or even a pulmonologist. Your rheumatologist should work very closely with your other specialists. It is very important that all of your healthcare providers work together as a team to manage your lupus. Preparing for a doctor's appointment can seem overwhelming at first, but there are ways to make the process easier and more manageable. It's important to be patient, especially when it comes to scheduling appointments. Your first opportunity for a good visit to the doctor comes when you schedule your appointment. Remember that it may take several weeks or even a few months to get an appointment as a new patient, especially with a specialist such as a rheumatologist. You'll also want to take the time to talk to the staff about why you're scheduling the appointment so that the office staff can schedule enough time and can take care of your concerns during the visit. The length of the appointment time depends on the type of appointment scheduled, such as a new patient, routine checkup, or problem visit. If you have urgent concerns, let the staff know. They may be able to work you into the schedule, but be prepared to wait a little longer in the waiting room. Also, keep in mind that you may need multiple appointments if you have a long list of concerns or if your doctor is working to give you a diagnosis. When you can, try to make your appointments at least a couple of weeks in advance, or even longer if it's your first visit with a new doctor. This will give you time to prepare for the appointment and allow time to transfer medical records from other care providers. Now that you have your appointment scheduled, you'll want to start preparing for it. A lupus diagnosis should be based on your symptoms, the medical history of your close family members, and laboratory tests. Start by organizing your medical history and tracking your symptoms. You'll also want to document if any of your close family members have lupus or another autoimmune condition. It's important for your doctor to understand what's happening in your body, and the description of your symptoms will be helpful. Symptoms both now and in the past. Along with your medical history, you should prepare a list of all of your current medications and supplements. Your doctor needs to know what medications you're taking, including those prescribed by other doctors, and any dietary supplements, such as vitamins or minerals. Write down all of the information on the label, such as the medication name, dosage, and prescribing doctor. You could also bring all of your medications and supplements to your appointment in their original containers. This way, the doctor understands the dosage you're taking, how often you're taking it, and the refill schedule. If you have a prescribed medication or dietary supplement that you're not taking for some reason, such as side effects or cost, tell the doctor that too. Any side effects you've noticed after taking a medication should also be reported. An organization tip is to keep a binder or folder with copies of your medical records. It is also helpful to keep a journal of your symptoms. The Lupus Foundation of America's National Resource Center on Lupus has several tools to help you keep track of your symptoms, like a lupus symptom tracker, lupus impact tracker, and they also have a medication tracker. Another way to come prepared is to create a list of questions ahead of time. Write down any topics or questions you have prior to your visit. Prioritize the topics and questions that you feel are the most important for your doctor to hear about. That way, if you don't get through your whole list, you will still have the most important questions and concerns answered. The Lupus Foundation of America's National Resource Center on Lupus has a list of questions you may want to ask your provider, especially if you are newly diagnosed or during a first appointment with a new doctor. You should also anticipate what the doctor will ask and think about your answers to these questions ahead of time. Your doctor will likely ask you different questions about your symptoms. Thinking ahead and having a symptom journal will be helpful in answering these questions. A few questions the doctor may ask include, when did the symptoms start? Does anything trigger the symptom? Does it interfere with your daily routine? Just to name a few. If you're in the process of being diagnosed, you may find it helpful to learn about the diagnosis process and what lab work may be requested. There are many challenges to reaching a lupus diagnosis, and learning as much as you can before an appointment can help you recognize different terms or tests that the doctor may mention, or even help to ease anxiety about the diagnosis process. This holds true for even those with a diagnosis. You may find it helpful to be informed prior to a visit, since new symptoms you experience could be related to a flare, medication side effects, or a new complication. Once your appointment finally arrives, communication is key. Don't forget to bring all of the information you worked hard to prepare before the appointment, such as your medical history, prescription history, symptom tracker, and questions. Remember, your appointment is confidential. Are you taking any over-the-counter medications for a different condition or on a diet? Do you have any stress at home? All of these things could impact your health, even if it is emotional stress. When you talk to the doctor, be as specific as you can about each symptom, when it occurred, and how it affected you. Don't be embarrassed. Your doctor has heard it all. If you're planning on discussing a personal topic, one way to avoid nerves is to practice what you plan to say in advance. You'll also want to consider who is escorting you to the office visit. You can ask them to wait in the waiting room if you plan on discussing personal things. It is also a good idea to bring paper and a pen so that you can take notes during the appointment. You may also ask the office to provide you with printed information about your lupus, medications, and treatments. This will allow you to review the information after the visit in the calm of your own home. You can also share these notes with family, friends, and caregivers to help them understand how they can best support you in managing and treating your lupus. Some doctors' visits may make you feel emotional, stressed, or rushed. It can be helpful to have a supportive family member, friend, or caregiver accompany you to these appointments. They may also be able to help by taking notes or helping you recall what was said during the visit. Also, it's important to keep an open mind. If you go to a doctor's appointment with a fixed idea about what is wrong, you and your doctor may overlook a key aspect of what could be causing the problem. Finally, do not hesitate to ask questions. You should let your doctor know if you have any questions or concerns before leaving. It's best to be proactive in voicing your questions and concerns, as opposed to depending on your doctor to ask the right questions. A lot goes into preparing for your doctor's appointment. It's not only important to prepare for your doctor's appointment, but be an active participant during and after your appointment so that you can get the care that you need.
Thank you, Ashley, for all the tips and for your insights and important information on preparing for a doctor's appointment. If you would like to learn more about living well with lupus, please find additional resources on the National Resource Center on Lupus. Or if you would like to talk with others affected by lupus, check out our online support community, Lupus Connect. Thank you and have a wonderful day.